Dear students, welcome back. In this session, we are going to discuss about posterior compartment of the leg. So, the back or posterior compartment of the leg is also called as the calf, which corresponds to the front of the forearm, and this is the bulkiest of the three compartments of the leg because of the powerful anti-gravity superficial muscles, that is gastrocnemius and soleus, which are the powerful anti-gravity muscles, and they are quite large in size. Okay, so because of these muscles, it appears as the bulkiest part. Okay, now, and this posterior compartment is one of the largest of the three compartments of the leg. Superiorly, it is continuous with the popliteal fossa, okay, and inferiorly with the sole of the foot. This compartment lies posterior to the bones of the leg, the interosseous membrane, and the posterior intermuscular septum. So, posterior intermuscular septum. So, this part is the posterior compartment of the leg. Okay, and if you see the contents, which are the structures we can see in the posterior compartment, are one is the skin, superficial fascia, deep fascia, muscles, and it consists of two arteries, posterior tibial and peroneal artery, and it consists of only one nerve, that is tibial nerve. Okay, and these are all the structures which are present on the back of the leg. And some of the facial extensions which are dividing this posterior compartment are the superficial transverse septum, and the deep transverse septum. Okay, the superficial transverse septum is well defined, whereas the deep transverse septum is thin. Okay, so this is about the overall view of this posterior compartment of the leg, and with the help of the septum, this posterior compartment is divided into three portions. One is the superficial portion, middle portion, and the deeper portion. The muscles which are present on the superficial portion are the gastrocnemius, plantaris and soleus. And then if you see in the middle portion, we can find flexor digitorum longus, flexor digitorum hallucis longus muscles. In the deep portion, we can find the tibialis posterior muscle. Okay, and there are number of contents which we can see in the superficial fascia, and so these septa which are formed are the modifications of the deep fascia, and also near the ankle. So near the ankle, the deep fascia which is present on the medial side of the ankle is somewhat thickened to form a retinaculum called as flexor retinaculum. So that flexor retinaculum we can see in the next session. Now in this session we are going to discuss about the contents of the superficial fascia. So here you can see the contents of the superficial fascia. So the contents of the superficial fascia of the back of the leg contains small saphenous vein, okay, and part of long saphenous vein. This is the small saphenous vein, and this one is the long saphenous vein. So this long saphenous vein we can see on the medial border of the posterior medial side of the knee on the posterior compartment of the leg. Okay, and if you see the short saphenous vein or small saphenous vein, this vein which is formed on the dorsum of the foot by the union of the lateral end of the dorsal venous arch with the lateral margin vein, it enters back of the leg by passing behind the lateral malleolus. Okay, in the leg it ascends lateral to the tendocalcaneus and then along the midline of the calf. So here you can observe this is the midline of the calf, and finally it ends into the popliteal fossa. Okay, so this is about the superficial veins which are seen on the posterior aspect of the leg, and next one are the cutaneous nerves. Okay, the cutaneous nerves are the saphenous nerve, which is a branch of posterior division of the femoral nerve, which supplies the medial part of the leg. And also we can find the sural nerve. The sural nerve is a branch of tibial nerve, and this one supplies the lateral aspect of the posterior compartment of the leg. Okay, and also we can find some of the branches on the medial side. One is the posterior branch of medial cutaneous nerve of thigh, and near the ankle we can see the medial calcaneal branches on the medial aspect. If you can see on the lateral aspect, so another cutaneous nerve of calf, that is lateral cutaneous nerve of calf we can see, and also posterior cutaneous nerve of thigh which can be seen at the center. Okay, so these are all the cutaneous nerves which are seen in the superficial fascia of the posterior compartment of the leg. In the next session we are going to discuss about the flexor retinaculum. Thank you.